Dr. Sachdev, for those patients that are not quite familiar with the IVF process and genetic testing, or maybe they're just starting off on their IVF journey, would you be able to talk a little bit about PGT testing and genetic testing and the options that are available?
Yeah, totally. So I think the best way to help explain it is to kind of, as a background, to understand that, every person comes from an egg and a sperm. We often call them mom and dad, but it's an egg and a sperm, and we get half of our DNA from that egg and that sperm. Typically, we'll get 23 and 23 to equal 46.
Mhm.
So if the egg and the sperm have half the DNA, well, that means that since we all have 46, there has to be a division that occurs for both egg and sperm.
Right.
Because men are making sperm every 90 days,
Hmm.
that mechanism is fairly well maintained. Even if somebody is 60 years old, the sperm that they're producing is actually only 90 days old. So when that sperm goes to divide, it happens pretty well. So the sperm typically will have exactly what they need, 23 chromosomes. But for women, we're born with all the eggs that we have. And as we're getting older and we have less eggs, our eggs are the same age as us. So if I have a
Hmm.
patient who's 30 years old versus 40 years old, somebody has 30-year-old eggs versus 40-year-old eggs.
Right.
When we go to ovulate, whether that's naturally or during treatment, during the ovulation process is when the division occurs to say, okay, we need exactly 23
Hmm.
chromosomes. And so the longer those eggs have been in our body waiting to complete that, the more likely they are to make a mistake in that. So if
Right.
somebody is 30 versus 40, the 30-year-old eggs, regardless of the number, are more likely to have the appropriate chromosomes than the 40-year-old. When
Hmm.
the sperm comes swimming along, 90% of the sperm are going to have the appropriate chromosomes. But ultimately, if they fertilize and go to make an embryo, we don't know if that embryo has the appropriate chromosomes, 46XX or 46XY, or if it has an additional chromosome or is missing a chromosome.
Hmm.
So we have the ability to say, all right, let's take out a few cells from this embryo, which is made up of hundreds of cells, to say, okay, if we take out a few cells, which should represent the entire embryo, can we determine what the genetic makeup is of that embryo? And that's what pre-implantation genetic testing is. And so there's different things that you can test for, but the most common one is called PGT-A, which is looking for aneuploidy, the number of chromosomes.
Hmm.
So they take out a few cells and they take the DNA from there and they amplify it. And then they can identify, okay, this embryo actually has 47 chromosomes. It has, two copies of everything, but it has three copies of chromosome 16.